When patients think about academic medical centers, they're coming here for the leading edge. What's the newest thing that can help me or my family member?
The purpose of research here is not really, okay, how many grants do you have? But more important question to us is that, what's the impact? We know the science, we know the evidence. How do we get to implement that science? How do we get our patients to take their medications?
We have to ensure that we have a structure to maximize the population and community health impact of our research.
If I have to describe our research mission and impact at UH Rainbow Babies and Children's, I would say it's simply transforming children's lives, one life at a time, with compassionate and cutting-edge care.
What's being done here at UH is really being translated across the world and improving outcomes for cancer patients.
We have the largest clinical trials unit in the state of Ohio. We have actively 113 trials that are ongoing in the Harrington Heart and Vascular Institute.
We've brought in over $50 million in research grants through the NIH in a very short amount of time.
Research is how we will accomplish our mission to improve and reduce the suffering of cancer globally.
The question always becomes, how good are we? We're ranked 8th in the US and 16th globally. That's impressive. But you know what? I believe it's possible for us to achieve a higher ranking both nationally and globally.
You can do research and innovation, but you can do it really well if you work together.
This is obviously a very important day for us to celebrate research at university hospitals. And today is a day of thanks and gratitude for all of you. So before I start, thank you so much. We like to start out with a declarative statement that the state of research at university hospitals is very, very strong. This is a record year in 2024. And in the next 45 to 50 minutes, I want to go very quickly through the great accomplishments of our researchers and our research teams. Remember that at university hospitals, we are about advancing the science of health and the art of compassion. And in our strategic plan for our academic mission, we are a next generation academic health system dedicated to accelerating discovery, innovation, and translation of scientific breakthroughs which address unmet clinical needs and enhance the lives of our patients, our community, and the world. Why is research important? We've talked before, research is about hope, and science saves lives. And I want to focus, we'll start to the right of this because we've talked about some of the others before. Quintin Pan's work in HPV positive head and neck cancer and cervical cancer with a first trial using fenofibrate, a cholesterol-lowering drug. Rapid CAR T by David Wall, taking a 4 to 6 week commercial process down to a day. Mehdi Shishibour's limb saving for patients scheduled for amputation. And of course, our three musketeers, Chak, Markowitz, and Willis, and the dramatic changes in Barrett's esophagus and preventing the fast-growing esophageal cancer problem that we have. Now, perhaps during questions, we can talk about the potential impact of changes politically on research in the United States, but there's no question it's responsible for over $33 billion of our gross domestic product, almost 350,000 jobs, and it is the basis for new medical therapeutic discovery in the United States. It's very important for us as a health system. It enhances health system differentiation. It attracts patients. It improves healthcare outcomes. It attracts all of you, our top talent. It produces intellectual property. It drives philanthropy. And most importantly, it creates an enormous biomedical system impact. It is estimated that Cuyahoga County alone is responsible for $129 million in direct research-related economic activity at the narrowest level. Let's look at our metrics for 2024 before we really dive into details. Over 3,400 active clinical research studies, 1,400 plus publications, 73 invention disclosures, lots of student and trainee rotations, but most importantly, a record year in research attainment, $214 million, both to university hospitals at $119 million and $95 million through CWRU with NIH, DoD, and NSF. This represents a 9% growth in our total research portfolio, 13% growth in research expenditures from pharma industry, biotech, and other agencies such as HRSA, PCORI, and the CDC, and a very significant increase in research indirects that we'll talk about a little bit later. This just visually graphs this for you, which is to show the consistent year-over-year research growth, which is really very important. Our indirect allocation supports our clinical research infrastructure. It supports our health services research. It supports the UH academic mission with respect to grant writers and biostatisticians. It returns support to the departments. And very importantly, it is the basis of our K award support and our K to R transition for our junior faculty, which are really important for our future. Now, academic partnerships are key, and of course, our most important partner, Case Western on the left, really the basis of our relationships from CFAR to the Comprehensive Cancer Center grant to the Alzheimer's Disease Center to the Institute for Computational Biology, and on and on. But we have other partners which are emerging that are very, very important for our future. Jobs Ohio and the Cleveland Innovation District, our very, very important relationship with Northeast Ohio Medical University, NeoMed, and of course I'd like to call out that both Dean Stan Gerson and President John Langell are here. Thank you so much for your support. Of course, science lives outside of the United States, and we're very proud of our partnership with the #1 university in the world, Oxford, through our Oxford Harrington Rare Disease Center, our efforts with Morgan Stanley, with Technion in Israel, and National Taiwan University College of Medicine. Now, there are a few things that deserve mention right out of the gate, and I think one which is obviously very important, under Gary Schwartz's leadership, and of course the important contributions of Alan Deal, Alex Ajay, and Ted Technos, we have a fundable score for our Case Comprehensive Cancer Center, which will bring us 7 years of funding. Again, we have that little hiccup of when the council will meet to actually award that grant, but we are very confident that that will take place. This has been an enormous, almost 2-year effort by Gary and his team, and we are very proud of their work. Talk a little bit about our intense work in the Joint Strategic Leadership Committee, which is the CWR-UH Operating Committee that really focuses on the recruitment and retention of top talent. As you can see here, committing over $19 million from 2021 to 2030. We have been able to recruit fantastic new researchers. Everybody, as you can see here, from Rebecca Obang starting in 2022, all the way now to Marilla Cascalho and Evie Stavru in 2025. It's also been a very important mechanism for us to retain our outstanding faculty, and you can see those who have been retained here, including most recently Andrew Pieper, Yoni Shoag, and Jordan Winter. One of the things that we've been really trying to do is link the hospital and the medical school together to really stimulate translational research. And these come from the Collaborative Science Pilot Awards. These were the brainchild of the late Bob Salata, and you can see the collaborative awards from everybody that you hear, from organizing and curating large-scale data for an MRI fingerprinting database, single RNA sequencing for Alzheimer's, genetic risk for early keratoconus, a probiotic approach to treating GI symptoms associated with autism, and bradykinin in cerebral edema and malaria. This is really important because it is the basis of future grant applications in team science, and it is proving that most of these individuals are actually writing and submitting those grants now. We're very proud of Jobs Ohio that brought $17.5 million to university hospitals. We have checked off now 3 out of the 4 boxes of our deliverable over the next 10 years. We are way ahead of our research expenditure growth from our base year of about $161 million. Our growth has been $121.2 million versus an expected of only $40 million through year 1 through year 4. We're very confident that we will achieve this. And of course, we thank our board and one of our board members who is here, Bob Smith in the front, for their $30 million investment in drug development. Very important to advance educational opportunities within the research and innovation space for our caregivers and for our faculty. The Fellowship in Academic Medicine, FAME, in Research, FAMAR, and Fire and Innovation, with lots of learners. And we're very, very proud that the UH Research and Education Institute fully sponsors the tuition for these courses, which ranges from a low of $7,500 to a high of over $15,000. So congratulations to all of you who've been inducted into these cohorts and who are applying for future cohorts in learning. Now, one of the other things which is really important is to promote collaborative team science through 2 new very important research initiatives, and I see several of you in the audience. Our UH Hearing and Research Center between UH and Neomed with Nicole Maroney and Mary Rosen, and our latest Neurodegenerative Research Center and Aging Center with Andrew Pieper, Asif Sheikh, Martha Sajadovic, Sheila Fleming, and Moses Oyewumi. Very important, getting people together, again, collaborative symposium and future team science awards going forward. So we're very excited by these collaborations. Now, I want to call out for all of you who are here very important accomplishments within this comprehensive wheel of bench to bedside, from scientific discovery to translational research to clinical research and impacting the world with many, many collaborators that you see here on this slide. I'm going to take you through this rapidly. We are very, very proud of your accomplishments, and we have your photos. Feel free to take a picture of them. We will have this all available for you to take down to show all of your loved ones. Now, the first thing I want to do is call out some places that are really excelling in ways that we couldn't really have imagined. And that, of course, is our Radiology Research Institute in collaboration with Case Western, led by a variety of individuals that you see here, but I want to especially call out Donna Pletch's vision to really accelerate this, along with other key people, Jim Basilian, Agata Axner, Mark Griswold, and really many others. But in 2024, $10.9 million in new grants as PIs, and a total of $16 million in new grants to total investigators with over 99 publications, and you see all the grants listed here. This is the power of working together, and I urge you all, go down into the basement level of university hospitals and see how PhDs and MD PhD scientists are right beside our 5 MR scanners working together to make new algorithms to not only diagnose disease, but to prognosticate response to treatment. It is very, very exciting. Another group is a very special one to me because it is that of the surgeon scientist. I was an interventional cardiologist, a procedural scientist, and it's very hard to combine those, but I give a lot of credit to Lee Ponsky and Adonis Ajaz for creating this very novel parallel pathway to allow surgeons to become very successful in science. And you can see here in 2024, 102 active research studies, 119 impactful publications, $33.6 million in total research funding since 2021, and $12.3 million new alone in 2024. And I will talk about David a little bit later to really call out his contributions to that. Also would like to call out, as I see many of our Seidman investigators and TED Technos here, is the incredible work of our clinical trial team, increasing accruals by 35%, external revenues going up from $9 million to $19 million in the course of the last 3 years. And I call out our top 5 clinical enrollers, David Bajor, Pedro Barada, Ashwin Dalati, Amit Mahipal, and Leela Matheny. Congratulations for your work, bringing especially phase 1 clinical trials to patients who are really in need of something new. Now, I am very focused on the next generation. University hospitals, just like other institutions, has what we call the graying workforce, and that is our senior scientists are getting a little bit older, and we've got to make sure that we have that farm team, we have the single to AAA coming into the majors to help us out, and that is our K awardees. And I'm very proud of these 6 individuals, Priya, Stephanie, Abigail, Stephen, Wilfred, and Luca. These are our K grants, K23s, 08s, 01s, in a variety of areas that you see here. These are the mentored science awards for individuals who are on their way to that so-called bifurcated and independent career. And it's the basis of moving forward. But to show you how, I think, nurturing we are, the K to R transition is happening successfully at UH. I call out Stephen Carpenter, Thomas Raffay, and Rui Wang for their work. As you see, their K08s, and then their transition now to independent R awards, R01s, 21s, and R03s, and an R37, and a DoD grant. This is the hope that we all have. Nationally, transition from K to R funding is in the 25% range. It's higher here, and that's because we have very strong faculty mentoring groups that help these individuals move on. So congratulations not only to the scientists, but to their mentors for making this happen. Now let's focus for a moment on what many of us think is really key, which is the foundation of what we do, which is scientific discovery and target identification. Without that, we can't move to translational and clinical research. So very quickly, Professor Matsuyama, for his amazing work on prevention of blindness by orally available cell death inhibitors, the observation that BAX is key for photoreceptor cell death, and that an inhibitor of BAX M109S can potentially prevent blindness, at least in animal models. This is the basis for IND-enabling studies necessary for future FDA approval. We are very proud of him, and we can't wait to see this show up into the clinic. Atul Chopra from the Harrington Discovery Institute made a seminal observation. I never learned in medical school that the cerebellum controlled thirst, but I now know that now from his amazing work in Nature Neuroscience, that asparocin, which he discovered, produced by adipose, regulates obesity and metabolic state, also controls thirst. And this is a seminal discovery, which is very important for thirst disorders like psychogenic polydipsia. Important work from our key pediatric colleagues, Peter McFarland and Catherine Meyer, related to SIDS and the importance of predictive biomarkers and the role of the extracellular matrix not previously understood in this condition. And so very proud of their $2.8 million R01 award in this space. Would also like to call out Ruben Stepanian, a PhD scientist in the Department of Otolaryngology. Really tremendous work targeting mitochondrial calcium uptake to mitigate acquired hearing loss. Really important, and now drug discovery efforts with about 50 potential candidates. These are already FDA-approved drugs to block calcium uptake and to potentially improve acquired hearing loss. Very important for many of us in the room, and for our parents who are now with hearing aids. Would also like to call out one of our newest recruits, Tyler Miller, from Mass General and the Dana-Farber, a phenomenal glioblastoma researcher in the Department of Pathology, who has worked on developing a foundation to create effective immunotherapies for brain tumor patients, publishing an absolutely extraordinary paper in Nature just came out in February of this year, of programs, origins, and immunomodulatory functions of myeloid cells in glioma and glioblastoma. And what's very important is on the bottom here, which is that he's building a platform for discovery in translation using our partners of Case Western, CCF, and University Hospitals. You see some of those here, Dr. Tiffany Hodges and Dr. Mike Stout. So really key, and we're so lucky to have Tyler, and I believe he's probably in his lab on the 6th floor still working right now. Quentin Pan is here with us, and I already talked a little bit about him. This is work that is a little different from repurposing fenofibrate, but involves a reactivator of P300 and P53 in HPV-positive head and neck cancer. This is a compound called, I guess, the second generation OHM6, which has very promising efforts in this very difficult to treat space. So congratulations to Quentin and his team. Again, a new award of $2.8 million over the next 5 years. Of course, Jordan Winter and his team here that you can see has continuing to work on IDH1 as a therapy in pancreatic cancer. He has a clinical trial that they've already done first in man with ifosidenib in targeting pancreatic cancer. A new award again in 2024, $3.3 million with the aims that you see here. This is a very difficult to treat cancer, less than 5% 5-year survival. We need new therapeutics. So congratulations to Jordan and to his team. Let's now say, and we're going to move to the translation part. So how are we going to get some of this basic discovery into patients? And of course, whenever we think of that, we think of the Harrington Discovery Institute. Dr. Jonathan Stamler, the president and co-founder, Seth Field, our chief scientific officer, and many others who are here today, Diana Wetmore, as I look out and see you, incredible efforts at addressing the unmet need of new medicines, getting new medicines into patients in major disease areas, in brain health, and in rare disease. And we're very, very proud, especially of our new efforts with the Oxford Harrington Rare Disease Center. UH has committed $100 million of both of our operational dollars and, importantly, our mission-related investment dollars to bring 100 new drugs through sponsoring 100 scholars, 40 drugs into clinical trials with 6 to 8 EMA approvals in the next 10 years. Very aggressive goals, but we think that we can do it in this space. As you can see, our impact to date in a little over 10 years, this is now 11 years, 203 medicines in the making from 72 institutions in the US, Canada, and the UK. 43 companies have been launched, 21 medicines in the clinic now in clinical trials from phase 1 to phase 3, and 15 licenses to pharma. We're very excited by the progress of the Harrington Discovery Institute. Now, one of the things that's very important about these discoveries is to make sure that we have a very strong tech transfer office, and I saw Neil here and his team to make sure that we are in 2024, 73 invention disclosures, 171 patent filings, 32 deals, raising money, and then you see the selected spin-outs of companies, and of course, my two favorites, Lucid Diagnostics, because I saw them ring the bell, so to speak, when that went public. And then, of course, very fortunate to be a co-founder of Collida Therapeutics, my own company, with Yoon Mei and Ed Plow. So we're working very hard to develop a humanized monoclonal antibody for inflammatory conditions, and have been very fortunate to receive support for Harrington myself. Of course, you see investing in promising companies is an important part of UH Ventures. David Sylvan, Kip Lee, and others investing, and then very important healthcare collaborations with a variety of funds. Now, let's talk a little bit about how this research gets to impact patients. And of course, we think of Dan Spratt and his amazing work advancing AI to transform personalized therapy. This is the first AI-based biomarker in the NCCN guidelines across all cancer cell types. This was validated in 12 randomized trials of prostate cancer, as you see here, and it received CMS approval and Medicare payment for the Atera AI prostate cancer test. This is the kind of thing that we need to be doing in the AI space. We're doing it in radiology, and we'll see at the end we're doing it in cardiology. But this is really important to go from 12 validated studies to NCCN guidelines, and then to Medicare payment. Very important for our patients. Leo Bittencourt is really leading our efforts in the UH radiology space. Incredible relationships as part of Radical with consortium, with platforms and standalones to be able to do this well. We are part of co-development, validation, and data collaboration with a variety of partners. Very, very proud that in 2024 we were named a member of the American College of Radiology's AI Consortium, a limited group of institutions, and further collaborations, as you see here, with Mass General Brigham, Siemens, Better Medicine, and others. And you can see that the AI space, of course, is global, and we need to be in that global space. Well, what about accomplishments in clinical research? This is unusual. And on this slide, first, prion disease is deadly. No treatments. And we have been very fortunate that Brian Appleby has been leading our National Prion Disease Center. It's the only center in the United States to do that. It is the first industry-sponsored clinical trial in prion disease. It is the first transcontinental prion disease study in 16 sites across 9 countries. UH was the first site to be activated and the first to enroll a patient to bring this ASO therapy injected into the intrathecally to reduce expression of prion proteins. This is incredible. Never in our lifetime did we think that this could potentially be possible. And it's happening here now. It is going to no longer be a death sentence. And I think congratulations to Brian for his perseverance and his resilience in getting this done. Would also like to call out really great work by Emily Steinhagen and Satish Viswanth related to new radiomic signatures for the treatment responses to neoadjuvant therapy in rectal cancer with the new R01 award in 2024. Of course, I can't have a session without my favorite 3 musketeers, Sandy, Joe, and Abitab. They are really changing the face of how we're going to treat and prevent esophageal cancer. We're very lucky that Barrett's precedes esophageal cancer. So we have a way to not only pick up a condition that predisposes, but to treat it before you get the esophageal cancer. In 2024, the guidelines changed. We're moving from endoscopy to diagnose and treat Barrett's to actually using balloon to diagnose and then guide therapy. And you can see the trials keep rolling in. A new 5-year R01, $7.8 million for a clinical trial of EsoCheck and EsoGuard, and a $5 million grant for this bad biomarker to predict Barrett's esophagus with low-grade dysplasia. Unfortunately, esophageal cancer is an obesity cancer. And as you know, obesity is now up to 40% of the US population. So we have got to do something to prevent this cancer, and this work is coming from here. Congratulations to this amazing crew. And then, of course, a favorite area for me and for Mehdi is our work in transcatheter aortic valve technology. We now do more catheter valves in the awake and talking patient than we do surgical aortic valves in the US and in the world. But we have a problem now, which is we've been doing this for so long that mechanical valves and these catheter valves, which are both a stent and tissue, can have breakdown over time. We have people who've had these now for over 10 to 12 years. And the question is, what's the right way to do a repeat procedure? And we're very fortunate that our own Guilherme Adesanya is the international PI of the RESTORE trial, which will look at how we understand and what are the best approaches for redo TAVR. 100 centers will do 225 cases. And of course, Guilherme is our star that is helping to lead this trial. Also very fortunate that our sports medicine team of James Voos and Jacob Kelsey have completed our MSc FDA trial. This is the first FDA-sponsored trial for MSCs in osteoarthritis. And you can see in this MRI that in 16 patients enrolled, you can actually see improvements in cartilage in the knee joint for patients with osteoarthritis. And things are advancing through this amazing ARPA-H award to many, many investigators over 20 million in the first phase, 27 million in phase 2 for this concept of the living joint, columetics, being able to put in scaffolds that will grow own tissues and create an effort to grow artificial joints. So a lot of investigators involved in this, both at UH and at CWRU. Now, what about impacting the world? That's very important. So we can have basic discovery and target identification. We can translate. We can go into clinical trials. But if we find something that works in a clinical trial and people don't use it, it's not of value. So implementation science is very, very important. And it's our fastest growing portfolio. We're very fortunate that Sambora is now the director of this amazing center, and what we have to do is make sure that we participate in research in this area of implementation science. So I've already called out David Shine as a hint earlier on. He received a nearly $9.2 million PCORI grant from the Patient-Centered Outcome Research Institute to look at the comparative effectiveness of two treatments, urethral sling or a polyacrylamide hydrogel, for managing stress incontinence, urinary incontinence. This is a big problem. And PCORI wants to know what is the right treatment for these patients, and that's the BELIEVE trial. So congratulations to David. This is a 6-year, 11-site trial that will enroll over 470 women in this trial. We are also very proud of Amru Siraj. Many of you know that he received a top 10 in the U.S. Clinical Award for his work in the SELECT trial, which was managing a different population of patients. But in that original trial, they discovered that not only was thrombectomy better than clot-busting drugs for independence, a 3-fold increase in independence of the patient with thrombectomy compared to clot-busting drugs, but they started to see that patients presenting later and later in stroke had benefit from thrombectomy. So they did a smaller study to show, in fact, that if you treated up to 24 hours, there was benefit. And so PCORI has funded for $7 million over the next 7 years a trial comparing thrombectomy to best medical care in patients who present with large vessel occlusions beyond 24 hours. UH Cleveland Medical Center is the global coordinating center. So congratulations to our clinical research center and to the team around this, 44 sites across the US, Canada, Europe, and Australia. This is a very important trial, and it really shows the capabilities of UH is not only to lead in clinical trial enrollment, but actually to lead a coordinating center in that space. I'd also like to call out very important work in our emergency room combating the opioid epidemic, Project Alto, a mix of our emergency room and, of course, our Connor Whole Health team. You see here Kieran, Ryan, and Sam, related to a $1.5 million grant using acupuncture and music therapy in the ED in the setting of pain. And this is really very, very important. It's very objective, with very objective measures of pain relief. And we are thrilled with these new approaches instead of giving all patients opioids. Would also like to call out the great school-based research work of Sarah Ronis and her award of nearly $700,000 to look at community-engaged aims to reduce chronic absenteeism among low-income age children with asthma. This is really very, very important. It is amongst the most common chronic conditions of childhood with substantial public health burden, and we're really proud of Sarah's work in this space. I would also like to call out the work of a fellow who's now a rock star in the cardiology world as an associate professor, Varun Sundaram, who started with us as a fellow, who got his PhD in the UK, and has just been tearing it up in this heart failure space of very large data sets. So this is big data epidemiology, coming up with a HFpEF risk score that you see that was published in Nature Medicine, and now leading trials, serving as a global PI for projects translating into late-breaking clinical science presentations in international conferences. And we're very proud of not only his presentation as a late breaker at the Heart Failure Congress in 2024, but he informed me, of course, that he's now been picked also for a late breaker in April of 2025. So this is just a wonderful opportunity. He's been also named the Deputy Director in our Health Services Research Center. For all of you who are interested in big data epi, talk to Varun, who's actually here. You can have some refreshments with him afterwards. I mentioned Sam Bora already, but I can't say enough about Sam's energy, commitment, and passion for health services research. He was recruited to Rainbow and UH by Marlene Miller. This was a special prize that we didn't know about, but we had a national search, and of course, as often happens, the best candidate is living in your own institution. He now oversees a combined cumulative portfolio in health services research of over $100 million and is doing great things in education, in developing the tools for faculty and fellows, and especially junior faculties, to receive K and then independent support. The dollar of grants in this space are breathtaking, and UH must be at this table, not only for the direct reimbursement, but also the very high indirects that come with us that allow us to reinvest in our investigators. Well, we're getting close to the end. And of course, I want to recognize all of those in 2024 who were promoted to senior faculty. We had two incredible passion speakers, Amy Edwards promoted to associate professor, and John Sontich promoted to professor. And I think both of them really gave us some very keen insights about their journey and the importance of promotion to them going forward. And of course, this is the full list of all of those promoted. So congratulations to our 35 new senior CWR promotions in January and July of 2024. And I understand from Marjorie that 2025 will look good as well. So stay tuned for 2025. Okay, of course, I'm very, very proud and invested in this announcement of the dear Iris Wolstein's gift and that of her late husband, Bert, to advance our academic mission, to have a space to convene, to learn, to discover, and to simulate. This is a now $30 million plus building, as Stathis and I would say, on Euclid Avenue, next to the library, the museum library, and then of course right in front of our emergency medicine on the green space. We're only taking half of it. The city's very concerned that we maintain green space next to the parking garage. That will have conferencing to have 570 in the grand ballroom, 330 on the third floor, many breakout rooms and simulation. This is going to be a transformative place to come together. And we want all of you to use it, all of your departments, all of chair events and celebrations. This is going to be a public space, not only for UH and CWRU, but for many members of University Circle. I'm working tirelessly with Ryan Cross and Stathis to raise the other half of these funds so that we can break ground. We have a commitment to the board that we have to have another $7.5 million of cash in hand before we break ground. Iris is 96, and we are committed to breaking ground in the next 12 months, and so we'll continue fundraising for this project. I think you see that picture of entering the lobby. You're in the concourse and looking into the grand ballroom and looking up into the light. It's going to be absolutely fabulous. Some special recognitions, National Academy Inventors, senior members that you see here, James Basilian, Agata Exner, David Wilson, and David Wall, congratulations. And then very important new appointments of leadership. David Bajor as Medical Director of the DCRU, Beth Hagesfeld as Vice President of Research in the Clinical Research Center, Grace McComsey as our new UH Clinical Research Integrity Officer, and David Spratt as the new Medical Director of the CRC and Associate Chief Scientific Officer. A lot of people to thank. Best team I've ever worked with. Our UH Research and Education Institute, great leaders, really fun to be together, a lot of good Zoom and in-person meetings, and as you can see here, a very powerful and happy group. I love these pictures, and it's just great to come to work, to be here every day and work with you. Some research support highlights. This is very important. Our UH Clinical Research Center, Seidman Cancer, the DOMS, and many others. 160 audits, 4,900 submissions to our IRB, 60 FDA regulatory submissions, incredible work by Investigational Drug Service, grants and contracts, and our clinical research education. And you see the pictures of these amazing teams, and especially our UH mobile van that goes everywhere from Amish country to inner city to enroll. Really very important. And if any of you have special things that you really need to use that mobile van for, please reach out to us. We're happy to do that. Of course, want to thank Jory Mintz and her incredible team in raising money. We can't do this without funds. 2024 attainment, just unbelievable. $47 million, and you can see some of the big ones, as we say here. And her team is just fabulous. They get a lot of applications and a lot of requests. We're now in the position where we have to prioritize a little bit, but record attainment, and thank you very much to that incredible team. We have an amazing research support highlights and a team led by Yi Fritz, Lisa Hackel, Nicole Bollinger, Abigail Zona, and Shelley Parkhurst, who make this whole thing happen. And today obviously wouldn't be possible without Yi, Nicole, and Abigail especially putting this together. I mean, this is a labor of love. I say to Yi, not enough people. We need more pictures, more pictures, more pictures, and you can see it's just really an amazing thing, and they do an incredible job. We have 1.4 million page views now. Our web traffic is way up. Our Science at UH podcasts, they're really fun to do. We're getting everybody involved in these now, and downloads are increasing, which is really great. Now, this takes a long time. In 2012, 2013, some people came to us. Good buddy of mine I went to college and medical school with said, Dan, we're developing an AI-based algorithm to change the way that we diagnose coronary artery disease. We want you to be the leading coordinating center in the trial, and we're going to give you a little prize at the end if you do that. In 2016, when this was approved by the FDA, we did the first case in the United States. Last week, in Nature Medicine, AI imaging using CT angio with heart flow saves lives and reduces healthcare costs, done in the National Health Service in the UK. This is a home run. But this has taken a long time. And this is what we want to do. This is what we want to do across the board. We not only want to save lives, but we want to make it better for patients. 50% of the patients in the United States who go to the cath lab have no significant coronary artery disease. Why are they going to the cath lab? And this technology will save $2 billion in the US a year, which is why it was approved by the FDA. And I'm very proud of this group. Of course, Sanjay Rajagopalan and Chip Gilkison were the drivers of this, along with two people who are not here now, but Haram Bazira, who thought it's much better to be in Tampa, Florida, where it's warm. Of course, every time there's a hurricane, he has to text me pictures of the water coming up into his front door. And Marco Costa, who went all the way down to Brazil. So we owe Marco and Haram a great debt of gratitude, but Sanjay and Chip have really been the drivers, and many others subsequently. But if you take a message home, this is it. It's hard work, takes a long time, but technologies that we develop here can save lives and reduce healthcare costs. It's really pretty cool. All right, you know the question I always ask. We think we're good, but are we good? And of course, we never could have imagined this, and that is that in 2024, we are now ranked in the top 10 in the US and top 20 in the globe. I think when we recruited Stathis from Boston and we said to him, Stathis, we're going to be top 10 and top 20 at CMC, he probably was thinking, what are these guys? Like, what are they on? But we got there, top 10 and top 20, and now our goal, of course, is to go higher. I'm not going to make any predictions about how much higher, but we're going to go higher, and I think we owe a lot of gratitude to Oxford University, who, as I said, has been giving us a lot of uplift and updrag as they went up to number 2. Our Oxford Harrington Rare Disease Center has been very helpful to get us up in the rankings as well. So I think we're good, and I think we can even be better. All right, so looking ahead, what do we need to do? We got to recruit faculty to foster team science through collaborative and interdisciplinary efforts. It's not only recruitment, but as you saw, it's also retention. And then, of course, we have to, this is tough today. We've got to augment and diversify our revenue streams for academic activities. This has got to be foundation, industry grant support, indirects, IP, commercialization. We got to get some self-sustaining flywheel royalty and equities to help support us. We need philanthropy, and we got to hope that things get solved in Washington. That'll be something that we can live with. And of course, we have to continue to strengthen our academic partnerships because they're the basis of all of our success. It's all about collaboration. And you see that our partnerships extend from the National Taiwan University to the Middle East and Israel, to Oxford in the middle, to Case Western, and then a stone's throw away, Neomed. And we're so proud of those partnerships and so appreciative. Thank you. Happy to take any questions. We got microphones on the side, and we have a couple hundred people on Zoom apparently, and we have some people monitoring that for questions as well. And then we'll get you out to refreshments and some things very quickly. Any questions? Oh, here we go. Joe.
I just ask you, we email back and forth, but could you just talk about the environment of big data? We all want big data, and how to make it user accessible to all of us in our own spaces.
Okay, so Joe Willis asked a question about big data. We all want to use it. How do we make it accessible in our space? That's a great question. So I'd say a couple of things. One is we have a new deputy director in health services research for big data. His name is David Axelrod. He is a transplant surgeon from the University of Iowa. He's been here now about 6 months plus, and he's a big data guy. And that's one of the reasons why he was recruited here. I think we also have the Institute for Computational Biology, and Jonathan Haynes and Mark Bino are doing an amazing job of giving us access through a variety of databases, Trinetics within CRC, other databases, Immerse especially, through the University of Michigan, to millions and millions and millions of patients. And then, of course, I mentioned Varun, who has access and can help us in that space as well. There's no question that we have the people who are experts there. If you have questions, I would turn to David, to Jonathan and Mark Bino, and to Varun to start. But there's no question that asking questions to millions of patients in many instances is a very important part of what we need to do. So thanks for that question. Any other questions? Well, I guess it was very clear then. So anything online? Anything online? Okay, so without that, this is a fabulous picture, and I thank all of you for everything.